Hello, everyone. Welcome to another review class. Today, we shall be focusing on the Taiyang channels. It's another 100-point um, activity. Okay, let's welcome Ma'am Trix of Sampaloc, Manila. Good afternoon, Ma'am Trix.
Good afternoon, Doc.
Okay, where does the small intestine channel begin? Um, Sorry for the question. Parang it's vague, no? Ang pangit ng question. But anyway, sige, you may answer it no matter how the way you want it. Maybe you would like to tell us where it is located, the first point of the channel, or what is the first point, or where does, kasi there are, sa iba nag-uumpisa eh, but this one is different, di ba? Okay. What's your answer?
It's in the small intestine one point
Yes.
or the jingle. It's a jingle. It's
So
a
as you can
jingle.
see, nandito po siya. Hmm, there. Okay, what are the organs entered by the small intestine channel?
The SI, the stomach, and the heart.
Good. This is quite important because especially when you have patients, no? And you may encounter cases where you are wondering, ano ba talaga ang nangyayari? But um, uh, if you know the channels quite well, then you would be able to understand why all these organs are involved. Okay, what are the crossing points of the small intestine channel? There are 11 of them.
The crossing points are LI 14, DO 14, UB 41, UB 11, stomach 12, REN 17, REN 13, REN 12, GB 1, GB 11, Sanjiao 20, Sanjiao 22, and UB 1.
Okay, mamaya we will explain what are crossing points. Now, let's talk about the branch one of the small intestine channel. Okay. This is actually branch one. So what is being traversed here? And what?
It's the stomach 12, the outer canthus, the E.
Okay. Outer canthus of the, yeah, and then the ear.
The
So may
E.
branch one, may branch two. Where is it? So the branch
Branch
two is somewhere here.
SI 18,
Yeah.
the cheek, the inner
Yeah,
canthus.
this one, no? Yung ganyan, yung parang pyramid dyan. Mhm. What about branch three?
Branch 3 is stomach 12,
Going to
the heart, the stomach, yes, and then the stomach, and then in the SI, and then the stomach 39.
Okay, we mentioned kasi kanina it also affects or traverses the other organ. And it
Mm.
enters the stomach
Yes.
and the heart as
Okay.
well. Next, um, can you tell us about the luo channel of the small intestine?
The logo is the point is SI7. It's in
Okay,
the heart channel and ascends to LI 15.
okay, this one. Okay, correct. And what about the divergent channel of the small intestine?
The version is in the shoulder, the axilla, the heart, and the SI.
Okay, that's the divergent channel. So if you will have issues on those areas, then probably you would know what channel of the small intestine you are going to make use of. Now let's go to the more commonly used sinew. I know the more common complaint, which is the sinew channel of the small intestine.
These usual complaints,
Ito
it's
lang,
in the
oh.
wrist,
Mm.
wrist to the medial condyle of the humerus, the
Okay.
axilla, mastoid process,
Yes.
mandible, outer canthus, and stomach ache.
Okay. Very good. Okay, what's the jingle point of the small intestine channel, which promotes lactation and benefits the breasts? So this is particularly effective for women who cannot lactate, who cannot nurse their their They're babies, no? Mhm.
SI1.
Okay, so we usually do moxa here. Yeah. This is the location of SI1. If you're a fan of ear acupuncture, dito po siya. Okay? Yeah.
Ano ba?
Now let's go to the next one. Ying spring point, which clears wind heat. Hmm? It benefits the eyes, ears, and the throat.
SI2.
Okay, good. So this is also called the, if SI1 is the metal point of the SI, what is SI2? Ano ba sunod na metal? Bakit tinawag
Wood.
itong spring? Ha?
Wood.
Water point. Yes.
Sorry, water.
Galing talaga ng taga
Meta water.
memorize niya. Sa tenga lang yan, ha? Oh, di ba mas mawindang sila dito mo na
Meta.
tinusok. Between
Meta
1 and
water.
3 dito. Yeah. That's the reason why it's called the water point of the SI because di ba pag sa Young channel nag-uumpisa, don't ask me why, basta SI, any Young channel, ang first point is actually the metal point, and then the water point yung sumunod. So point 3 would be, the third transporting point would be called the shoestring point. So this time it's called the wood point, and this is called the master of Dumai. It regulates the Dumai, or the governing vessel. So kaya this is so effective if you have issues with the back, especially the upper back. Okay? In fact, we call this the opening point of the Dumai.
It's SI3.
Yes. Have you tried doing this on your
Um,
patients? So this is
no.
SI3, no? SI3. Oo. So if you notice from SI1 to SI17, andun po lahat yan because we all know that the SI is the young the young, ano no, external uh, counterpart of the heart channel. Next, let's now go to Yuan source point. Okay, so it also clears the heat. And this is the empirical point for jaundice.
It's SI4.
Okay, this is SI4. SI4, if this is 3 and this is 8, so SI4 must be here. Okay, let's now go to the Jing River point, which clears heat, reduces swelling.
SI5.
Okay, good. Ito po yung SI5, and this is the location on the ear. Next, she cleft point. It moderates acute conditions and it benefits the eyes.
SI6.
Okay. This is the location of the SI6. In fact, if I'm not mistaken, this is also called the nursing the elderly point. So, di ba pag medyo maidan na, malabo-labo na yung mata? So, since the SI is related to the heart, then you might also be able to see improvement with your vision temporarily. So the SI6 should be here. Next, luo connecting point. Sabi mo kanina, yeah. So luo connecting point. It clears heat. So that means it actually, when you say connecting, example, ito, low connecting ng SI. SI is the yang channel. So when it clears the heat, you're actually reducing the yang. So when you reduce the yang, you tonify the yin, right? So it benefits the finger joints. So nagko-connect siya sa heart channel. So sinisedate niya yung yang, yung SI7, pero ina-activate niya yung yin. Ay, sinabi ko na, SI7. Andito po yung
Seven.
SI7. It's 5 soon from SI5. And andito po siya. Alam nyo, you should try this. Wow, kahit i-ano mo na lang dito. Ay nako, lalo na sa mga ano. Ano to? Sa may elbow. Yeah, elbow. Elbow, wrist. Okay. Then the Husi point. This is okay. Yeah, it clears heat and swelling. What is this point?
SI8.
Okay. Is SI8. Actually, katabi din niya yung isang point. Dito pala banda yung which is very good for tennis elbow. Kasi I had a patient who plays table tennis. Medyo sumakit na yung niya. Anyway, it benefits the shoulder. What 2 points of the SI channel?
9 and 10.
Galing naman, grabe. Okay. These are actually local points. You can actually feel it, no? So tusukan mo ng ano ba to? Yung ating ginagamit na yeah, ng press. Tapos SI. Yes. Um, if it's tender, you have to needle it. Pero para mas mawindang yung patient, dito mo ilagay 9 and 10. Or actually mawawala yung pain when you just rub it. Okay. Now, another point which benefits both the breasts and the shoulder.
SI11.
Yeah. Ay nako, you do this on women, they would really love it. This one. Okay. Especially when you needle it here. They'll find it amazing. No? So 9, 10, 11. Yeah. Okay. Sa tenga lang pala. It expels wind and benefits the shoulder and scapula. What point is this?
SI12.
Okay. Andito po yung SI12. If you know this one, hanapin mo yung gitna niyan. No? And that's SI12. Okay. So here pa rin siya. No? Next, benefits the shoulder and the scapula.
SI13.
Yes. So if this is 12, this is SI13. So that's the next. Another point which expels wind and cold.
SI14.
Yeah, this is so common among masarap yan dyan, itusok. O igwasya mo dyan, ang
I
sarap.
use the,
Yeah.
I don't know.
And this will make you very familiar with the scapula. Especially kung pag skinny yung patient. Ay nako, masarap yan. Okay, and you should remember that the SI14 is on the level with the bladder 11 and GV13. No? Yan. Okay. Next, descends lung qi, a point in the lung channel which descends lung qi. So this is very good for lung qi deficiency.
SI15.
Yes. And it's somewhere here. Kaya inidle mo na lang SI14, SI15, 14, 15, 12, 13, right? 11, 11, 12, 13, 9, 10. O, di ba? Ay, dito pala yung 10.
9
Yes.
9 to 15.
Yeah. Andiyan pa rin sa likod, oh. May naiisip na si Sir Jobel. I'm sure maraming pasyente yan ng ganyan. Sa tenga lang. Okay. Are you familiar with window of heaven? Oo, hindi yan pupunta ka sa heaven. Pero when you say window of heaven, this point actually improves the flow of energy between the head and the rest of the body. So, pag medyo magulo ka sa isip mo, masakit iba-iba mo. So, that this is SI, what is this?
SI16.
This is especially effective for goiters, throat issues, no? So naka-level lang sila. If you know where stomach 9 is, uh, kung saan nag-bifurcate ito, yung head, yung sternal and clavicular head of the sternocleidomastoid. That's your LI18, and then sa dito sa pinakahuli is your SI16, no? So yun. Of course, you don't
But
need
di
to.
ba, it's not safe, not so safe to needle there.
If
I
you
mean,
first you need to know the structures that are quite delicate. You need to know them, no? So as long as you don't feel any pulsation, that's safe. So you need to be
okay.
able to locate the muscle talaga. Okay? So if you feel unsafe, if you're not very sure, dito mo na lang inida.
Here,
'Di ba sa ear na lang.
here.
Kasi kung natatakot ka, matatakot din yung pasyente. So it becomes unsafe. So benefits the throat and neck.
SI-17.
Okay, it's here. Here. Mm. Actually, when you do lifting, dapat mo ito SI-17 with the ano here, TB-17 ba to? Okay, next. A point that eliminates wind and alleviates pain, clears heat, and reduces swelling.
SI-18.
This is my favorite point when I do lifting, no? Oo. Ito yung ano natin, landmark. Level lang siya with the outer canthus. Oh, ito. Ganun mo siya, tapos tusok mo yan. Or, this time, andito ka na sa anterior ng ear. Oh, ganun. Oo. If you want this to be lifted, you just needle this. Or you put an intradermal until patanggalin mo lang kung natutulog na siya. You will love it. Magli-lift siya, tapos mag-collagen ka, o di ba?
That nga.
Ay, madidiscover ako na, ay, kaya lang bawal mag-promote dito, ha? Na-discover akong coffee na may 300 milligrams of collagen. Lumaki talaga yung mata.
Oh, wow.
Pero hindi pwedeng ikwento dito, baka maano, magalit si doktora pa lang. Benefits, ears, and calms the spirit. So, we're not here to
Uh,
promote any, ha? Wala akong sinabi. Pero ano lang tayo,
SI-19.
benefits the ears, calms the spirit. Yun.
It's SI-19.
Yes. There. Where does the SI channel begin? Ito, obviously, it's SI1, but I think we should answer kung anong anatomical location ng SI1.
It's in the ulnar side of the tip of the little finger.
Okay. How many crossing points does the SI channel have?
11.
Wow. And you already mentioned all of them earlier, right? What organs does the SI channel? This was also mentioned. For review lang to.
Yes. Um, a heart, stomach, SI.
Okay. The tissues entered by the SI channel.
In the eye and the ear.
Okay. Linkage to the next channel is from which SI point and to what other channel and point? So, paano mo ililink ito sa kanyang um, associated channel?
So from SI-18 to UB1.
Ito, mag-link dito. No? Mhm. What is the unique pathology of SI channel?
Yellow sclera.
Yes. Okay, it's very good for the eyes. Okay. What are the SI pathologies? List.
There's deafness, yellow sclera, sore throat, swelling of the cheeks, distension and pain in the lower abdomen, pain in the posterior border of lateral aspect of the shoulder and the arm.
Yeah. Sore throat there. Okay. What is the SI channel's interiorly exteriorly paired channel?
The heart channel,
When the primary channel goes from SI18 to SI19, then wraps around the ear, it goes where?
internal,
There are no SI points that treat what kind of problems, even though it goes to the stomach.
digestive
Yes.
disorder.
She cleft point of the SI.
SI6,
Yuan source point.
SI for
Front mo.
Ren for
Okay. Itong front mo, it's usually mostly diagnostic lang talaga, no? So if you feel tenderness around 4, then there's definitely an issue with the SI. So this is Ren
oh,
4, Kuan Yuan. And then this is the Ren 4 on the ear. Diba? Nice. So
oh,
safer. Next, Bakshu of the SI.
UB27.
Yeah. What's the Bakshu of LI? So UB25. What ba? Ganun siya. Yan. So, lower Hussey point of the SI.
Stomach 39.
Katabi ni stomach. Ay, hindi pala. Sa baba pala ni stomach 38. Sorry. One soon. I think everybody understands this, no? Oo. I hope.
Stomach 30.
8 soon. So that's 15 soon in total from the lateral malleolus. And then this one is here sa may natawag dito. Okay. Andito po yung ST39.
8
Which
yun.
point clears heat?
16.
Yeah, I think this is a repeat. Which point clears heat and promotes lactation and benefits the breast? And what do you call this point?
SI1 or the Jingwell.
Jingwell or the metal point, right? Which point clears heat, benefits sense organs, revives consciousness, promotes lactation, benefits breasts?
SI1 also.
Which point clears wind heat, reduces swelling, treats toxic heat, benefits eyes, ears, throat?
SI2.
Good. The earth point of the SI channel is
SI8.
fire point,
SI5.
wood point,
SI3.
water point.
SI2.
What is the full name of the bladder channel?
Urinary bladder of the foot Taiyang.
Actually, malito. UB channel. It should be the
Which
bladder channel of the foot Taiyang. Internal, external pair of the UB.
kidney.
Okay. Cross the clock pair of the bladder. So, di ba, ang bladder is 3 p.m. to 5 p.m. So, ano
Lungs.
yeah, lungs. 3 a.m. to 5 a.m. I'm actually thinking of something. I'll let you know. May naisip na naman ako. Kasi they were so like the Rotarians, they were so impressed with the organ clock. This was emphasized kasi by Dr. Ryan. Galing talaga. Grabe. So I was thinking for them to really appreciate this, we might kasi they were so excited when I told them we can do a lot of things with the seeds, di ba? Mm. Six,
Yes.
yeah, amazing. Lalo na si Sir Albert, no? Grabe. Ang dami niyang alam. Six
Ay,
division.
tulog yun.
Yeah, hindi na nga namamansin eh. Meron na siyang mga tinatago. Okay. Okay. Ano yung sixth division pair ng UB?
Taiyang of hand.
Yeah.
The SI channel.
Ito yung sixth channel staging. UB primary channel goes to which Zhangfu?
Kidneys and the UB.
Yes. Do 16 is in line with what bladder point?
UB45.
Grabe naman. Do 16? Oo, bladder 10.
10. 10.
Parang layo naman.
Not so sure.
Parang, parang, parang imposible naman yan. Okay. What is the tune measurement for UB9 and 10?
1.3
Yes.
to the
Where
midline.
does the UB channel first split?
Within.
Yes,
for
11.
blood pressure.
Grabe talaga.
Ayan.
Alam niya, memorize. Where did, natatense na ako mag-ano dyan eh. Kasi ang dami ng alam, wala nang ginawa kundi aralin. Where did the two branches meet back up?
UB, kidneys and heart.
So the first one is UB11.
Sorry. UB 11 pala.
UB40.
Sa 60. Sino ba?
Next. The divergent channel goes to which organs or areas?
UB, kidneys and heart.
What about the anus?
Yeah. Okay.
Pati puwet. Dapat
Anus,
anus
yes.
pala is. Yeah, dyan no.
Mhm.
Kita nyo yan, the anus, the kidney, the heart. Next, which channel treats this? Okay, we're talking about what channel ng bladder. Alam naman natin, no, marami tayong klaseng channel. The primary, the sinew, the lu connecting, then the divergent. Okay, strain of the little toe, pain and swelling of the heel, spasm of the popliteal region, popliteal, inability to raise the shoulder. So, anong channel ang dapat mong ayusin?
UB5.
No. Which type of bladder channel? It's called the sinew.
Yung
The sinew. Tingnan nyo man yung sinew on, mga dinadaanan niya lahat. Okay. How many tune are between stomach 8 and 2? Sa ulo na to ha, stomach
4.5 soon.
Yes. How many tune between posterior and anterior hairline?
12 soon.
How do you determine your anterior hairline? Anyone? Go. First, hit your intang. Then, hindi ko papakita kasi baka par malayo na. Okay, it's like 3 tune from your intang. 3 tune.
Yes, four
That's the
fingers.
anterior. Ang galing
It's
talaga. Okay, can you tell us more about it, madam? Sino ba yung nag-ano? Thank you. Parang may marinig naman tayo ibang boses. Nahiya tuloy. Okay. That's 12 tune. How many tune between the bottom of C7 and posterior hairline?
3 soon.
Yes. So from the posterior hairline, yeah, okay. Kaya it's when you're trying to locate the do 14 between C8 and T1, di ba? Between C7 and T1, C8 and T1. Kailangan alam mo na saan, di ba? So hanapin mo muna yung posterior hairline. Di ba 12? So from the posterior hairline, you count 3 tune. That's your C7. And then you would be able to locate your do 14. Ay, 3 tune, di ba? 3. How many tune from anterior hairline is bladder 3?
0.5 soon.
Yeah, it's 0. GB24, do 24, bladder 13. Most bladder points of the head are how many tune lateral from the do channel?
How many points? Wait, wala akong answer.
1.5. Remember? 2
1.5.
fingers, 2 finger breaths. Diba? 1.5. What anatomical feature is important to know about bladder 9 and 10?
It opens the mind's orifices.
Yeah, the presence of the greater occipital nerve. What is the Hosi point of the bladder channel?
UB40.
Yes, that's UB40 and it's here din sa ear. Diba? What is the lower Hosi point of the Sanjiao?
13, UB39.
Okay. Katabi lang ni 40. How many tune between the gluteal fold and the popliteal crease?
14.
Okay.
Tune.
How many tune from the popliteal crease to the lateral malleolus, tip of the lateral malleolus?
Yes.
Sir Jobel, kanina pa to. Yung 8 soon, 16, di ba?
Mhm.
Ito, from the gluteal fold to the popliteal crease is 14. Where is the Bakshu point of the lung?
UB13.
Yes, that's it. So for the ear, this is 10, that's 30. Try mo na lang i-estimate. Where is the Bakshu of the heart? Level with T5 and do 11.
UB15.
Yes. Where is the Bakshu of the gallbladder?
19. UB10.
Okay. Where is the Bakshu point of the spleen? Level with T11 and do 6.
UB20.
Yes. Describe the bladder channel from start to end. So where does it start? Sige.
It starts at the eye, then goes up and over the back of the head to bladder
Okay.
10 at the
Okay.
base of the skull. And then from bladder 11, it starts at T1 and goes down to 30, then down to 54 in sacral foramina, then down to 40 at the back of the knee, then back up to spine,
Okay.
and then 60 behind ankle to lateral pinky toe at 67.
What's the front move of the bladder?
Ren 3.
You know the measurement? How many tune from the navel?
4, 3,
Hmm?
4, oh wait, 6.
4 tune.
That's 4.
That's 4. Ano
No,
yung...
4.
Okay, let's ask Sir Jobel. Ilang tune yung... Asan dito yung Ren 6?
So 1.5 tune
From the navel.
Okay.
from the navel.
Saan si Ren 4?
3 tune.
Galing. Okay. So 4
4.
tune ang Ren 3. Okay. So andito
Ren
na po
4.
siya. Dito na lang. Hindi pa
Sa
masyadong
ear.
embarrassing. Bakshu point ng bladder 14 is the Bakshu of the
Pericardium.
pericardium. Yes. Bladder 16 is the Bakshu of what?
Governing vessel.
Yes. Bladder 17 is the Bakshu of the...
Blood.
Yeah, this is also called the influential point of the blood. How to locate it? Level of the this of the scapula, di ba? The spine of the scapula. Okay? Malapit sa kilik. Mababa ng konti. Madali mo naman yan malocate, lalo na pagpayat yung patient. Bladder 18 is Bakshu of what?
Liver.
Wait. Bladder 21 is Bakshu of...
Stomach.
Yes. Bladder 22 is Bakshu of...
Sanjiao.
Bladder 23,
Kidney.
bladder 24.
C of chi.
Okay. Bladder 25, Bakshu of...
Li.
Okay. Dito na malapit na siya. Dito na siya. Level na siya dito sa ischias. Ano ba to? Yan. Basta ma-feel mo yan.
Iliac
Ay, wow.
or some
Grabe.
iliac or
Iliac spine. Yan ba yun?
Iliac.
Wow, talaga nakakahiya. Diyos ko. Yeah, you see? Pag nagtuturo. Bakshu point of the, bladder 26.
U1. U1 point.
Okay, so andito lang po siya. So kung ang 25 dito, LI, ito yung bladder 26. Bladder 27, Bakshu of...
SI.
Yes. Okay, what are the bladder influential points?
Bladder 11 for bone and bladder 17 for blood.
So we have 2 influential points. There's one technique that if you really want, i-combine mo yung yuan source at saka ang influential point, no? Ayun ba yun? Ano, yung,
Yung
sorry, she cleft plus influential point.
oh,
Sorry.
point. That's the one I asked the last. Wait, kailan ko ba tinanong?
Yung alam ko na. Combine
Na
she
pwede siya
cleft with
pwede siya i-combine.
influential. So you have to know what are the influential points. Okay.
Point.
Antique point is another name for, it's the old name for the
Influential.
transporting points or the shoe points, no? So ano po yung antique points ng bladder and the elements?
Uh, six. Ladder 67 is metal.
Yes.
66 is water.
65.
Kasi wala ka. 65 is wood. 60 is fire. 40 is earth.
Okay. So which is the orary point here?
Ferrari is
Orary is if this is a water point, no, if this is a water element, that's also the water point. Parang double kill. So the orary point here is
66.
66. Jingle point of the bladder.
67.
Yuan source point of the bladder.
60.
Orary point of the bladder.
66.
She cleft of the bladder.
Ladder 59 for young motility and ladder 63 for UTI.
Okay, so if you have issues with the foot, with movement, no? You use bladder 59, yung mga nasasakitan lumakad. But if you have infections like damp heat, UTI, bladder 63. Siyempre masakit yung pantot. 59, 63. Okay. Confluent point of the bladder.
62 ladder.
When you say confluent point, we're actually talking about the points of the special points of the extraordinary vessel, no? So it expels heat or cold in one-sided headache. Command points for the bladder.
Ladder 40 for low back, 60 for upper back, and then ladder 11, 17, and 67.
Okay, inidol mo na lang. Okay, ladder 60, upper back. Window of heaven and bladder.
Ladder 10.
Yes. Low connecting point of the bladder.
58.
So you're actually affecting the kidney here. No, parang may link ka sa kidney. Jingming, bright eyes, entry point.
UB1.
Tongtian, heavenly connection.
UB7.
And the last one, the celestial pillar, Tian Shu, point of window of heaven on lateral aspect of the trapezius, 1.3 tune lateral to 215, edge of the muscle.
UB10.
Okay, thank you so much everyone for joining. Congratulations, Ma'am Trix. Talagang wala kang palya. And also Sir Jobel for participating kahit buti hindi siya naiwanan ng bus. Okay.